For patients with excess fullness of the neck, what patients call the double chin, a turkey neck, a waddle, for most patients, the most effective procedure is tumescent technique liposculpture. With this procedure, under local anesthesia, the exact and precise amount of fat is removed with very small instruments. And then the skin will typically tighten up and kind of wrap around the jawline and under the chin to give a beautiful outcome. There are multiple new modalities that have been introduced in the past few years to try and accomplish this in a less invasive way. So currently lasers are used to dissolve fat, ultrasound, radio frequency technology, and cold. And all of these procedures can to some degree remove fat, but they can't do it to the same degree that liposculpture can. So I'm going to get started with your procedure. And the first step of this is I'm going to make exactly 4 very small entry points. And these are essentially 2-millimeter slits in the skin, which are so small that you will never find them. You will not have a scar that you can see. This is our cannula. This is the instrument that we remove the fat with. It's very small and very precise, so we'll really completely and thoroughly and very accurately remove the fat here. So our aspirator is on. You can hear that noise. And I'm gonna start. Now you're gonna feel kind of a mechanical movement, but you have no pain, correct? So you're totally comfortable? Okay. There are some patients whose amount of laxity of skin just makes them not perfect candidates for the procedure, that they won't get enough tightening from liposculpture alone to get the optimum outcome. For those patients, we'll also add to the treatment regimen thermage. And thermage is technology that uses radio frequency electrical current to heat and to shrink the skin. And the biology of skin is that there is a temperature window that we can raise the skin to that will cause the skin and the collagen bundles in the dermis to contract, but at the same time won't injure or burn the skin. So there's this kind of therapeutic safe window where we can get tightening, but not injury to the skin. And we see immediate tightening, and we also see a delayed tightening that happens over about 6 months. The thermage procedure is a fairly painless procedure. There's no anesthesia that's used during the procedure. It's an extremely safe procedure. We've been performing thermage for well over 10 years, and we've done thousands and thousands of treatments, and we've never had a complication. And it's most effective when it's done in tandem with liposculpture.